Speaks. Charles?
Peter Barnes, thank you very much. The House Budget Committee member, Republican Congressman Jim Renacci. Congressman, thanks for joining us. The president just now acknowledging that prices will take a little bit of time, perhaps as much as 2 years, to come down. And also saying that he promises access for everyone. I guess that's a key word here. So two things. Let's talk about the price, because this is what everyone's concerned about. How do you pay for it? And from a consumer's point of view, having insurance that it doesn't cost an arm and a leg just to use the deductible.
Well, absolutely, Charles, and thanks for having me. What we have right now is Obamacare that is failing Americans because the prices are going up, costs are going up, people can't afford it, and their deductibles are too high. So as the president said, we need to make sure there's access to affordable health care. The issue here is, though, that insurance companies are already setting their prices for 2018. So it's going to take time even after the changes occur. And that's why it's so important to get some of these changes in place as soon as possible, because they're already setting their prices for 2018 based on the Affordable Care Act, Obamacare. So they're setting prices that are already escalating. We need to get these changes baked into the process so we can get the prices to start coming down a few years later.
What about the Medicaid dilemma? In fact, in your state in Ohio, it's estimated 454,000 people chose that Medicaid expansion. It's a very expensive proposition. If the plug is pulled on that, it could be really dreadful for your state and those constituents.
Well, absolutely. And here's the problem. I also sit on a budget committee, as you said, in Washington, and I'm seeing the costs skyrocketing. I'm seeing our expenses going up. I'm seeing our budget deficits growing rapidly, a lot of it because of Medicaid expansion. So what we really have to do is we have to take these dollars, give it to the states, make sure that they have, you know, we lessen the restrictions and allow them to change the program so it makes it work for the states. It's always great to say, give me the money, give me as much as you can, and I'll make things work. I was in the business world, Charles, for 30 years. I was a businessman. I had to work within the resources we had. The problem today is everybody thinks Washington has unlimited dollars. We know that's not the case. The states that took Medicaid expansion, even Ohio, they're using dollars that we don't have. We have to now look at the dollars, try and give those dollars to them and say, you make it work, because we can't continue to just keep spending and spending and spending. The deficits are going to continue to skyrocket out of control.
There's no doubt about that. Everyone waiting at this very moment for the Congressional Budget Office score. Republicans have tried to get in front of this, noting some of the failures, if you will, of the CBO in the past to accurately score items. Nevertheless, this is going to be a headline, and many people think the big key is going to be the number of people that they're going to say that will lose coverage. Of course, the mandates are going away, so it's only natural that people would lose coverage. What do you make of that?
Well, again, that's where we're going to have to get states engaged. We're going to have to get states. They're going to be the chemistry labs. They're figuring out how to make this work. But we can't just have dollars flowing out of Washington, unlimited dollars, because the budget just can't continue to hold those dollars. We just can't do it. I've seen the cost curves going up. So each state will have, and by the way, before Obamacare, some of the states were doing a good job. Some of the states already had some programs that were working. I think we're going to have to get the states re-engaged, but we're going to have to pull back those restrictions. When we get the CBO score, I'm sure it's going to less money, you're going to be able to do less. But states are going to have to figure out a way to make things work, just like a business guy has to do every day, just like a family has to do every day with the limited resources they have.
With President Trump promising access to everyone, a lot has been made over the idea that one thing you can do is bring down these barriers, these state-to-state barriers, allow for individuals to buy a better plan for them that might not be housed in their own particular state. But to do that will come with the Democrats, right? You can't do all of that in reconciliation. So the question here is, do you think that part of the plan will get through? Do you think that enough Democrats will be lured to get the 60 votes needed on the Senate side?
Well, it's interesting because I think some of my friends in the Freedom Caucus want to put the whole plan out today and hope that it gets passed, because they're saying, well, look, you're going to do part of this, but in the end, you're not going to get it done with the Democrats. I think what we're doing right now is a three-step process, as you said. We're going through reconciliation, where you only need 51% of the votes. Then we have a Secretary of Health and Human Services and Dr. Price, who already had this plan, which a lot of his plan is baked into this. He'll be able to do things as secretary. And then next, we're going to have to get Democrats and Republicans working together. So it's no different. At least we're going to be working together to make some changes in the end. And I think that's what's important. It's one of the things that didn't happen in 2007. The Democrats just pushed this plan through without really getting support from the Republicans.
It's funny to hear Democrats complain about that over the weekend, including Cory Booker. But having said that, you brought up the Freedom Caucus. Is there, and I know you guys don't want to negotiate on television because essentially that's what we're in the midst of, I guess. But what do you think can be offered to them to assuage some of their angst and have them get on board with this?
Well, many of the members of the Freedom Caucus actually were signers on Dr. Price's bill. They actually co-sponsored it. So a lot of the pieces of this are Dr. Price's bill. I think what we have to do is we have to look at some of their concerns. We have to see what we can get done. But at the same time, we can't let Obamacare continue to just go down the road. I compared this to a plane, and I was a pilot, where the pieces of the wings are starting to come off, and you just can't keep flying the plane. So we have two choices. Some people in the Freedom Caucus want to take the plane straight down, and I think there's others who want to say, let's find a landing place, let's find an airport where we can bring this plane down safely. But at the same time, we have to be able to do that and cut costs and get the curve. So that's what they're looking for.
Right.
Look, whether it's Freedom Caucus members or conservatives or even liberals, we can't have a budget deficit that continues to spiral out of control. And I appreciate what they're trying to do as well.
All right, Congressman, thank you very much. Appreciate it.
Thank you, Charles.